Thanks, Joey. You know, we all want to find the fountain of youth, but parts of our body will start to show our age, whether we like it or not. That's especially true around our face and the neck region. Dr. Michael Kim is joining us live in the studio with more on a popular alternative to get rid of some of those aging signs. Good morning.
Good morning. Thank you.
Dr. Kim, the turkey neck is usually a dead giveaway as to what our true age is, and a lot of us have to fight it.
Yes, the turkey neck, extra skin in the neck is a very common problem once you hit about 50, 60, depending on your genetics. So we have a lot of patients who are having facelifts. I think there's about 120,000 facelifts done per year in the United States. That's compared to the number one procedure, breast augmentation, of about 300,000. So it's a pretty common procedure. The average cost probably is somewhere around $11,000 or $12,000. But some people may not realize there's a reasonable alternative. I don't know if you can pull the first picture, but instead of a standard facelift with the incisions in front of the ear, behind the ear, and raising all up that skin, having all the bruising and the anesthesia, and anywhere from 2 to 4 hours of surgery to do a facelift, you can do what they call a direct excision neck lift. And this can be done on a local anesthesia. Usually in men, you can see how all the skin on the neck has been directly excised. So this is done under local anesthesia, no anesthesia. It takes about less than an hour. And the cost could be maybe a third to a half of what a normal facelift is, almost no bruising, minimal complications. And patients are extremely happy. Usually they're men because they can grow a beard, hide the scar for a while, but even some women get it. And as you can see, these are the patients that come in and say, you know, I just want this gobble gone. They don't care about their face. They don't care about their jowls. They just want to get that gobble off. And it's a very reasonable option for usually patients in their 60s and 70s. The younger patients generally don't want to have the scar on the neck, but that scar really heals up well, and it's amazing when they come up after about 6 months after surgery. It's really, really hard to see.
These before and afters are absolutely amazing, especially this one that we just saw there. I saw different types of scars. Are they zigzags, or does it just depend on what type of issue you have?
Well, usually in the neck, you have to do what they call a Z-plasty. If you just cut the skin out in a direct excision without a Z-plasty, you'll end up getting a web, like a tight skin. And you'll see that band, so you have to do what they call a Z, as you can see on that, and that relaxes that area, so when it heals, that area will not tighten up and look like a band. It'll actually look like normal skin. So we have to do that to release the scar tissue in that area.
And it only takes an hour, you said, and you don't have to go under full anesthesia. Is it incredibly painful to heal from, or is this something that's relatively reasonable?
No, so far most of the men have done, they've been working and driving the next day in their post-op visit. We also go in there and tighten the muscle at the same time, so it's a very good procedure to do for an older guy who just doesn't want to deal with a gobble, doesn't want to have the full facelift, you know, and those guys just come in and they just want that gobble up. It's a very quick and easy operation.
I would think you would want a board-certified plastic surgeon to do this.
Correct.
Can't be an
Someone has done
easy
a couple of
surgery.
these, and you know, it's not a very common procedure right now, but I think it's going to be increased as our population ages.
All right, Dr. Kim, thank you so much. And of course, we'll have more information on that on our website, winknews.com. Your time right now is 8:24. You're watching Wink News This Morning.